Hi, everyone. Welcome to Society for Black Neuropsychology Brain Awareness Week. I'm Dede O'Shea. I'm the chair of the SBN Education Committee, and I want to welcome you to our event tonight. This is the first of a series of talks that we will have throughout the week through Thursday. So please join us each day if you're able to. And we'll also be recording each of these sessions, so they'll be available for additional viewing throughout the week and into the future. Okay. If you're not familiar with the Society for Black Neuropsychology, we are an organization of professional neuropsychologists, as well as students and individuals training at different levels who have an interest in the brain, health, and understanding how it all works, as well as helping people with any difficulties that they're having clinically and overall promoting brain health and wellness. So if you haven't joined Society for Black Neuropsychology and you're either a student at any level, high school, undergraduate, graduate, please contact us at Society for Black Neuropsychology and join us, as well as any professionals who are here with us as well. We would love to get more people involved. Okay. For Brain Awareness Week, our theme this year is lifestyle habits for a healthy brain. And I'm delighted to be starting us off tonight with a talk about stress and brain health. I'm also joined by another one of our SBN Education Committee members, Anthony Robinson, and he'll be able to jump in and say a little bit more about the plans for the presentation today.
So hi, everyone. I'm Anthony Robinson. Today, I will be primarily going through the chat function. So if you guys have any questions or comments, feel free to drop them in the comment section. The way the talk will work is I will turn it over to Dr. O'Shea. And after she's done her talk, we'll open it up for a Q&A session. So if you have any questions at all, feel free to drop those in the comment box. I'll be monitoring that throughout the talk. And then at the end, I will be reading off any questions that you guys may have.
Right. Thank you, Anthony. So yes, feel free to jump in at any point, add your comments, and we will discuss more at the end of the initial presentation. I do want to highlight, before I get started, some of our other upcoming talks for later this week. Again, our theme is to cover lifestyle habits that help to promote a healthy brain. And so we will be reviewing this from all different angles, starting off with stress tonight. And then tomorrow we have Ronise Owens, who'll be speaking more about sleep and brain health. We also have Erica Pugh, who'll be discussing social support, the Black community, and how that relates to brain health. And finally, Dr. Ivory Walker will be speaking about physical exercise and brain health on Thursday. So again, I'm honored to be today's speaker. I'm Dede O'Shea. I'm a board certified neuropsychologist based in Boston, Massachusetts. I'm part of the clinical faculty. I'm an assistant professor at UMass Medical School. And I also see patients clinically through the Beth Israel Lahey Health System. And so really, this is my primary area of interest and specialization, is this intersection between mental health and brain health. So this is an overview of the talk today. Hopefully the formatting works all right. There may be a few pictures that have come across a little bit large here. The overview for tonight, I want to discuss just broadly health networks and health systems and how they relate to our current understanding and knowledge of brain health. And then in particular of interest with our group, I do really want to center this presentation on brain health in the Black community and marginalized communities and some of the unique features that's important for us to also be aware of and to recognize. Then we want to understand and recognize stress. Okay, that's a broad term that is used in many different ways. We want to start to be able to pick up the science of stress for those of you who may be actively researching or interested in stress, some of the different components and factors that relate to that. And then finally concluding with strategies for managing stress and continuing to promote brain health. Okay. So within that, the bridge here will be to understand how stress affects our neurobiology and our physical functioning, and then ways to promote resilience and prevent decline and changes in brain health. So really my focus is we need to talk about the bad and the ugly to get to the good. Okay, we want to end here with smiles, with feeling like we understand these relationships and have some tools to promote brain health and better manage stress in ourselves and in others, patients and people we know. So here's some broad visualization of mental and brain health and different factors that relate to it. So our focus tonight is on one piece of the overall puzzle here of how stress can interact and contribute to mental and brain health. There are a number of other different factors that also come into play, some of which you'll be hearing about throughout Brain Awareness Week. In addition to stress, we'll talk a little bit about the neuroscience and some of the biology and other contextual environmental factors, but each one of these pieces can have a significant impact on overall mental and brain health. With our current understanding of brain health, it is important, again, to start with some of the figures and some of the concerns that we have about the current state of brain health and disease. The number of people with dementia is expected to increase over time, over the next decades, as our overall population is getting older. So we're starting to have a greater number of people over 65 in our population in the US. And along with that, we expect to see the number of people with dementia also increasing over time. We have people like ourselves, neuropsychologists, other brain scientists, neuroscientists who are investigating these different areas. Disease itself, like Alzheimer's and other forms of dementia, as well as ways to prevent cognitive decline and promote overall health and wellness. We do know at this point, based on research that's already been done, some of the biological and environmental factors that seem to contribute to Alzheimer's, dementia, and declining cognitive functioning over time. There is, of course, also healthy aging that is also being studied. And we have individuals, within our organization, neuropsychologists, who are investigating actively each of these different areas. And then last, we're also starting to develop more knowledge about lifestyle habits, personal habits that can help people to mitigate the risks of those different biological and environmental factors that we'll be discussing to promote brain health and contribute to an overall healthier life. We do want to have a particular focus here on brain health in Black communities, marginalized communities. Along with that research and information that we are accumulating, we do know from many different studies of populations across the US that older African Americans seem to be disproportionately burdened by Alzheimer's disease, with rates almost twice that compared to non-Hispanic white populations. Okay, so the overall rate and diagnosis of Alzheimer's is increasing, but we are seeing that older African Americans are disproportionately affected. Okay, there seems to be both increased risk factors as well as the particular severity of the disease once it's diagnosed. Okay, some of those differences seem to be related to just overall cognitive performance that is also found between different racial and ethnic groups, which can lead to some challenge in starting to tease apart and understand what are the particular reasons that we're finding this disproportionate effect. Even without a full diagnosis of an Alzheimer's or a dementia, we tend to see differences between groups on our cognitive performance measurements. But I want to make sure that we also understand that this doesn't only point to there being a biological difference between the groups that's driving this. There's a number of different factors that can contribute to these disparities in both cognitive performance and eventual diagnosis of different brain-related diseases. So as I mentioned earlier in our pictorial, one of those potential factors that can impact mental and brain health is levels of stress. Okay, so we can start with getting on the same page together of what is stress, right? It's a word that everyone uses together. There are some particular definitions and aspects to it that can help us to understand how it can relate to our bodily functioning and affect our overall health and wellness. Okay. So stress is considered both a physical and mental response to a stressor, with a stressor potentially being something internal, so our own mental state that we already have contributing to the stress, as well as external pressures as well, also triggering and causing a stress response. Okay, stress can affect every system in the body. Okay, so it's has a mental component, a brain component, but it can affect all different bodily systems and influence how you feel both physically, emotionally, psychologically, and so on. Having some level of stress, we know, is a normal and can even be in some ways a healthy response to coping with everyday pressures, challenges that can come up, but it's considered to become unhealthy when it upsets your day-to-day functioning or has a lasting effect. So these are just a few signs of stress that we can look out for to understand where there could be a reaction that's potentially starting to go more into that more persistent, unhealthy side of things, and potentially, if it becomes chronic, lead to different types of negative health outcomes. So these could be changes in behavior. Someone is more irritable, short-tempered. They seem to only be able to focus on themselves and are less engaged interacting with others, or seemingly less empathic with other people. They may start to develop more intensity or ups and downs in their relationships as a result, just have less flexibility in their thinking overall. And then you may see other signs like increased substance use, alcohol, other drugs, and even food consumption. If there's a significant change, increase or also decrease in food and eating habits as well, that can also be a concerning sign for elevated levels of stress. And then all of these changes that start to happen in lifestyle habits can potentially develop into more specific mental health and physical health conditions. So just a number of conditions that we tend to associate with these chronic stress patterns would be a persistent depression. Again, just like with stress, there can be everyday sadness and blues, but when we get into persistent or severe depression episodes, that would be more of a concerning health outcome, as well as the more clinical diagnosis of generalized anxiety, social anxiety problems, a particular diagnosis of post-traumatic stress disorder. And then there can also be physical symptoms that we know are directly related to persistent stress. We'll talk a little bit more later on, but things like GI, gastrointestinal problems are often seen with chronic stress, and then changes in brain health and cognitive decline in mental abilities. So it's always good to put up a few numbers here so we can see the current state in the US. So information here for both children and adults as far as mental health. So this data is from 2022, and it's on the CDC's statistics website. So based on their national surveys, they found that 6% about of children, 5 to 17, were reported by their parents. So it wasn't directly assessing the children, but reported by their parents to be showing daily feelings of anxiety types of symptoms, worry, nervousness, or frank anxiety. And about 6% of children were receiving special education services specifically because of a mental health diagnosis or problem, as opposed to other types of learning issues or developmental issues. They also have some additional detailed information about the adult population. So compared to the 6% or so of children, about 12% of adults, 12 to 13%, were self-reporting that they were regularly having feelings of anxiety types of symptoms, and about 14% were actively taking medication. Hopefully that minor discrepancy is because some were taking the medication and getting a benefit from it. And then in comparison with these statistics by the CDC, about 5% were reporting at a given time in this year that they were regularly having feelings of depression, and about 11.5% were taking medications for that. And about 12.5% were saying that they were being counseled by a mental health professional. Okay. So we see in adults, over time, there is increased reporting of mental health problems. Again, the children were not directly assessed, but based on what the parents were able to visualize, about half were showing mental health anxiety at that time. And overall, on this website, they have very accessible the figures from about 2019 to 2022, and these numbers were fairly stable over that period, some increase in certain statistics. And so again, with our focus here on particularly understanding mental health, brain health in the Black community and other racial and ethnic groups, I did want to highlight some of the statistics here that they also have broken down by different census information. And so they did group all individuals identifying as Hispanic together, and then different races based on non-Hispanic only. And so from this information, which is an accumulation of 2019 to 2021, what we see here is that individuals who are identifying as American Indian is the AIAN, and white were reporting significant numbers of anxiety types of symptoms, as well as the Black and white multiracial group as well. And then we see variation, more similar numbers with the other groups, with the Asian only group reporting relatively fewer anxiety type symptoms. And then this is the report of feelings of depression in adults, again, broken down by racial, ethnic groups. And this is grouped a little bit differently. They have at the bottom here sort of non-Hispanic, and then white, Black, American Indian, or Asian, and it could be either that ethnic group alone or identifying as Hispanic and multiracial. And here we again see the American Indian group, does tend to have a significant reporting of mental health symptoms, with the Black population somewhat behind them. And then the Asian group here reporting relatively fewer depression symptoms, based on these self-report measurements for this national survey. So I do want to also highlight issues of access. So we have some information, some pictures starting to develop of what mental health looks like in the US broadly among different ethnic and racial groups. But who's getting treatment? Who's getting access, whether reaching out or able to be able to seek out those services. And so this is a little bit older data, but what we see here is that there are signs of some disparity in terms of who was able to access mental health services. This is just comparing non-Hispanic Black identifying individuals and non-Hispanic white, but we see about twice as many white individuals were accessing mental health services. Some additional data that I've seen is that this gap could be starting to disclose somewhat, but we do have some work to do to make sure that all of those who may need mental health, where we saw the actual numbers of those who are identifying as having these different symptoms was much closer, if not the Black population reporting slightly higher numbers. So we do want to start to close that gap in terms of access. And we have some of the work to do as mental health professionals, psychologists, and neuropsychologists. So you can see here, this is a graphic from the American Psychological Association. At the bottom, they have our overall population demographics from, this was published in 2020, I believe it was 2019 data, where overall about 60% of the population is white, reporting about 18%, again, Hispanic of any other racial group, and then about 12% Black and 6% Asian. When it comes to our psychology workforce, and this is psychologists more broadly, including psychotherapists and so on, we have about 6% compared to the 18% Hispanic, and they seem to have a little bit of an error here in their coloring, but the 4% Black to our 12% population and 4% Asian compared to the 6%. So there are disparities in terms of our current psychology workforce, and this holds true for neuropsychology as well. And that's something that is our mission and our focus with the Society for Black Neuropsychology, is to make sure that although we have that disparity, we're highlighting the needs of the Black community, as well as promoting and encouraging young potential neuropsychologists from different backgrounds to join us and also get involved. I do just also want to briefly highlight here what we're not seeing is some of the intersections as far as gender, other characteristics. We're also highly underrepresented in terms of Black male neuropsychologists, and so I just want to make sure to do my part and highlight that is an active area of focus in our group. And some other groups as well. And we do have a number of wonderful Black neuropsychologists involved with SBN. And so returning to our discussion of stress, and we saw a little bit about how stress can start to impact mental health and brain health. And I want to highlight here as well some of the external environmental factors that can contribute to overall experience of stress. So we know that throughout the lifespan, the lifetime, there can be a number of different situations and environmental factors that can be experienced as a real stressor. So this is even early in life, early loss, especially of a parent or close caregiver, being raised in more of a chaotic or tense family environment, or not having a security in the family bonds. Other adverse childhood experiences is kind of where those different factors are grouped into. And then again, throughout the lifespan, any experience of a lack of support system, loneliness, whether that's from friendships, relationships, other community relationships can be a stress. And you're going to hear more about social support in the community in one of our talks later this week. Poverty, lack of financial security, frank racism, at different levels, whether personal, more structural, systemic racism and discrimination. and other types of invalidating, stressful, hostile communications can all be forms of stress that can, again, be more acute, everyday experiences, or become more chronic and ongoing. I spoke briefly about adverse childhood experiences. This is a whole broad and growing area of research, but just to highlight briefly here some of the connections with brain health. So the adverse childhood experiences would be some of those things like the loss of a parent, especially early in life, lack of security in early life, and so on. And we do have evidence that people who have experienced a number of these different adverse childhood experiences, also called ACEs, tend to have more neurological conditions later in life compared to the average person in our US population. And then those people who have both high history of ACEs as well as a diagnosed neurological condition tend to just have much more medical and psychiatric needs. I do also want to highlight briefly here that there's much for us to focus on and highlight with the Black community as a whole. But there are also differences in characteristics, experience, types of stress that can occur with our diversity that we do have within the Black community. So just to go through briefly here, some of the latest census data from the 2020 census. We do have 3 major subgroups within the community in the US. Broadly speaking, they were grouped into sub-Saharan Africans, individuals of Caribbean origin, and then kind of other mixed, either unknown specific origin or just highly mixed groups. And then within that sub-Saharan African group, the majority were identifying as having heritage as Nigerian, Ethiopian, Somalian, and Ghanaian. And then among those who are Caribbean identifying, the vast majority were from these different populations: Jamaican, Haitian, Trinidadian, and West Indian. And I believe just with this latest 2020 census, there was kind of more specificity or a better ability to characterize individuals who were identifying, not just as Latino, Hispanic, separate from other races, but to have more combinations so that we can look at, Afro-Latino and other intersections as well. So in terms of these different potential subgroups, we do want to recognize that because of this diversity in the Black population, there is diversity that exists in cultural practices, even language. The majority of Blacks in the African diaspora has some English language proficiency, but that is certainly not across the board in terms of different countries, areas where people may have originated. There is linguistic diversity in African Americans, different educational experiences and education quality and access as a result of that health literacy, different religious and spiritual practices, and overall views of mental health. All of these can potentially affect engagement with the mental health system, experiences of stress, and how all of this interacts in terms of potential resilience or development of different mental and brain health conditions. There is some research showing that within the US, developing English language proficiency can be protective or support people in further engaging and seeking out help when needed, and related to that, experiencing fewer depression symptoms, perhaps an element of just overall acculturation as well, having fewer depression symptoms. And related to that, higher self-esteem and actually higher racial identity. So identifying with your racial ethnicity, perhaps, having a group, we can extrapolate to other potentially associated factors, but in terms of some of the research that's been shown, having higher self-esteem, higher racial identity was actually protective from stress and internalizing potential stress from experiencing racism. Right. So some of this we've discussed already in terms of Black Americans being subjected to greater degrees of different types of stress and chronic experiences of stressors, including race-related stress, has been shown to have a direct effect on body's physiology, okay, with elevated levels of different stress hormones in the body and chronic inflammation, okay, vascular types of problems in the body. So we have neuropsychologists and brain scientists who are actively investigating these areas, looking at the relationships between discrimination, racism, other forms of environmental and social stressors, and how that can affect cardiovascular function and even brain structure and functioning. So I do want to highlight just briefly some of how that biology and physiology works. I know we have, a kind of a mixed group here of, students, people interested broadly in brain health, and professionals. So we know that the brain is the central organ. It is directly involved in perceiving stress and how we respond and react to stress. Okay, as I mentioned before, everyday stress and changes can be a healthy response. Okay, we need the brain to get involved and perceive potential threats, help us to react to them. However, there can be damage and negative effects when it comes to more chronic, persistent experience of stress, or when some of the adaptations that the brain goes through tends to persist even when the direct stress is no longer present. Some of the research that is going on is also looking at the relationships and how they go both ways. So there's also evidence that as cardiovascular disease develops, that can also contribute to mental health problems, late life depression, and so on. So this isn't just a linear one-way relationship between stress and brain health and biology. Okay, it does seem to go both ways. To give you an overall picture of the biology and physiology here, another term that you might hear for the acute stress response is the fight or flight. Okay, so this is starting with the brain, some of the areas that control the production of different hormones, connects throughout the body, okay, to the thyroid area, and then down to the adrenal glands. Okay, so we're involving the whole body, as we mentioned, the stress. The brain is a central part of it, but it does connect to how your whole body functions and works. And just very briefly here to highlight then some of the other brain regions that then respond to those hormones. So the hormones are triggered by the stress, and then we also have neurotransmitters, other types of chemicals that signal different activity in the brain. These are some of the areas that tend to be involved in the stress response, the frontal part of the brain, and then some of the other deep structures in the brain as well. So a term that comes up is allostatic overload. This is the change that happens when the stress becomes chronic. And we start to see not only the physical changes in the body, but also some of those lifestyle habits starting to change, changes in personal behavior. Okay, so that HPA axis that I showed you connecting the brain, the thyroid, and the adrenal glands gets chronically activated. The hormones and chemicals never return fully down to their baseline. We also see then other bodily systems start to also be chronically activated. Heart rate, blood pressure, and overall immune reactivity. So as a result of those different chronic changes that happen with the allostatic overload, we can see associated health conditions, poor quality sleep, migraines, GI problems like IBS, cardiovascular conditions, mental health conditions. We talked about increasing substance use, and then even diabetes and autoimmune illnesses all seem to connect back to stress and that hyperactivity of that HPA axis. Okay, so there is a direct relationship, fairly direct association between stress and changes in lifestyle habits, changes in physical and mental health functioning. All right, so we mentioned we go through the bad and the ugly to get to the good. Okay, so at this point, there is information that we know can be helpful for starting to modify stress, modify responses, reactions to stress, and continue to promote overall brain health and wellness. So these are some of the general areas where that falls into, starting with what we're all here for today, education, right? Understanding all of these different pieces and factors and how they relate to each other and affect each other. And for your patients, other people in your life who you know, getting evaluation, okay, having that professional perspective on what are the particular experiences, particular physical changes that person could be going through that they may need some guidance and assistance with improving to the extent that they're able to. Okay, when we have that education and personal evaluation of things, we can start to work on lifestyle habits, making those changes, getting things back to either a healthier level or improving from where you may have started due to previous access and education. Okay, this can be personal, individual lifestyle habits. It can also involve the community, what exists in the person's area, their neighborhood, as far as access to physical activity, other social engagements, some of the things, again, that we'll be hearing about more later in the week with our other presentations. And then there can be professionally guided treatments in terms of mental health, psychotherapy, medications, whether that's psychiatric medications or other physical health medications to treat specific symptoms like cardiovascular disease, elevated cholesterol, and so on. And so just like stress is centered in the brain, we do see as well signs that what we can call resilience or overcoming stress can also be related to aspects of brain functioning, and it can be modified by our habits and practices and experiences. So there is some emerging evidence that specific networks in the brain related to perceiving and experiencing rewards can help to dampen down the consequences of also experiencing different stressors. And this is across the lifespan. So we know that even with adolescents and younger adults, again, focusing back on the Black community or racial stressors, developing that strong ethnic identity actually helped younger Black individuals to better be able to regulate and modulate those stress hormones like cortisol. So that was true in both white and Black individuals, but they saw a stronger effect in this study with the Black youths. And so by understanding some of that biology, we can start to further recognize and research potential interventions and strategies that can help to further build that resilience. Okay, so one of these is mindfulness, which we'll talk about just briefly here, and other ways to improve some of the attentional control, what we call executive functioning skills, which is like problem solving, organizing your thinking, maintaining motivation, flexible thinking, and so on, can all support overcoming and resilience. So mindfulness in itself is a very big topic. But just to give an overview of it here, it is a fairly widely studied practice now as one way of coping with stress and potentially even have an effect on brain activity and function. We want to recognize that mindfulness is a practice that originated in the ancient Eastern Buddhist philosophies. And it was more in the mid 20th century when it started to become popularized in the US and European, Western countries. Mindfulness itself is known to be a practice that is about cultivating awareness, cultivating attention, alertness, insight, right? All of these things that we aim to also do as neuropsychologists and neuropsychologists involved in more intervention, treatment work, or promoting brain health. And so it was natural that this has been studied more and more, especially since the 1990s, and has continued to grow as an area of interest today, which involves practices like controlling your breath, scanning the state of your body, focusing on what you're doing in the present moment, and so on. So I don't want to go too much into detail here, but this is just one example of a specific randomized control trial. So that's what we do if we're really trying to understand how like a treatment works and if it works better than a placebo, or just thinking that things will get better with the treatment. And there has been some mixed results when it's come to actual randomized control trials of mindfulness, but there have been some positive results here. There's also been some additional research looking broadly about using experience of more positive emotions, developing creative thinking, reflective thinking as another way to cope with stress and kind of build up mental reserve to be able to face any potential challenges to cognitive health later on. Right. And I just wanted to highlight here some of the work that I do. So again, I'm a neuropsychologist. I'm based in a psychiatry department. And in addition to doing a lot of diagnostic assessments, I also run a cognitive skills training group. And part of that is an educational component. We work on developing healthy lifestyle habits, training in some of those compensatory executive skills, and there's a component of stress management. At my hospital, we also have some specific groups that are focused on stress management, mindfulness practice, positive psychology, which is about kind of having more positive experiences, developing mindset, and then an overall lifestyle health program where people can work on weight loss, in particular nutrition, and so on. So I think these are things to be aware of in your own communities, your own clinics and hospitals. If you're a professional, are you engaging in some of these types of groups? Is that something that you can work into the types of activities that you're doing? And for those of you who might have a personal interest, see what's available. Talk to your PCP if you're not already involved in more of a psychiatry, behavioral health type of clinic, or neurology sometimes will have these types of groups as well, and just start to ask questions about what you may be able to get access to. Also want to highlight a couple of other resources. The CDC has a good kind of one-stop shop that has links to American Psychological Association, Alzheimer's Association, resources for LGBT, different groups, and so on. If you're looking for either additional, scientific information as well, CDC is a good place to start, some of those stats and so on. And then, as I mentioned before, we do have intersections. We have some disparities in terms of our Black men's brain health and mental health as well. A number of our members of Society for Black Neuropsychology have also gotten involved in this new initiative, Black Men's Brain Health, which is dedicated toward promoting additional research in this area and supporting scholars, early career scientists who are focusing in this area. So I did just want to make sure to highlight Black men's experience as well. All right. So to summarize here, we can see that stress and mental health problems sometimes can start out as invisible to others, even to the person themselves. We saw a few of the signs and changes in behavior or lifestyle habits that can be a marker of stress. Multiple forms of stress can impact Black people, Black community in particular, based on our society and unique experiences and stressors that we may face. At the same time, we do have specific research and information starting to grow about personal lifestyle habits and professional practices that can enhance overall health and wellness, including resilience and coping with stress. And our goal today and our mission with Society for Black Neuropsychology and other neuropsychologists is to continue to develop education, research, and support in the community to further understand all of these different areas, as well as increase access to needed care. All right. So with that, I will take any questions that maybe we can spend a few minutes.
So we've got a question. It's a two-parter. What are some of the ways in which adults can help their kids if they are starting to show signs of stress? And then what types of things should parents be specifically looking for?
Yeah, great questions. So starting young with children is wonderful. So I love that question. And so one of the areas that we highlighted earlier in the talk is just supporting children with their identity, understanding who they are. That's something as a parent that you can start with before even getting into, is there a specific problem or mental health going on. That's something that everyone can do, is supporting that self-esteem and developing their identity. If there are ongoing concerning stress signs, things that you're concerned about, then I would consider talking to a professional more about the specific signs that you're seeing. And primary care doctors, pediatricians are often a good starting place again, and they can use their knowledge to take things to the next level. Does this sound like there could be a particular problem, and if needed, connect to more of a mental health professional as well. So that's where we would typically recommend is, one, starting with your own relationship and supporting them, and then considering the pediatrician, primary care doctor as a good starting point for any kind of general stress or health issue. Okay. Did I cover that, or was there another part?
Yep, but you covered it.
Okay.
And just thinking about, practitioners and clinicians, what are some of the things that they can highlight specifically for their patients as they're kind of bringing more awareness about how stress can specifically impact brain health?
Yeah. So again, some level of stress is a normal reaction to challenges and experiences that every person is going to face, especially every person who's taken that step to connect with you and get into therapy. So starting to develop more of that awareness of either when things are becoming more of the chronic stress is when we start to see those overall problems and potential changes with their health. And if there's a change also in their usual habits, are they eating even more? Are they not eating? Are they saying they can't sleep? They're up all night having insomnia. They're getting into more disputes and challenges with people in their life. So looking for those fluctuations, changes from their normal patterns, or signs of chronicity to kind of reactions, beyond everyday stressful experiences.
Thank you. So it looks like we don't have any additional questions, but just from my perspective as a trainee and as a clinician too, um, in talking about kind of stress and mental health with patients, how do you even begin to broach the subject for folks who don't have quite like a good relationship with mental health, and how they talk about it, and it not being maybe something on the forefront for them?
Yeah, so you're doing a lot, just to be there with them, and if they're seeing you in a practice, you're providing them with some information and insights, and so that can be an opening for a lot of people, is just to hear that you're with them, that you're working with them to develop some understanding of things, and you'll be surprised by how much just that communication and opening the door can be helpful to a lot of people. And then if you're not feeling yet confident about having all of the words, definitely, looking at some of the resources that we talked about. And there's, a lot of other resources out there from our different neuropsychology organizations to talk about, bringing in brain health practices, lifestyle practices, connect people with a community related to what their particular issues are. So that's really, I think, a good place to start is just, sharing with them some of the insights that you're seeing from the work that you're doing and connecting them with additional resources.
Thank you.
All right. So I think that concludes our evening today. So thank you so much for joining us. Day one of our current series, Lifestyle Habits for a Healthy Brain. Make sure to check back in same time tomorrow, 7:30 p.m. Eastern, for Ronnie Owens' presentation on sleep and brain health, as well as Wednesday and Thursday. And if you miss a beat or just want to go back over what we've talked about today, we will have the recordings available on this YouTube channel, as well as our previous year's series are available as well. All right. Thank you, everyone.